Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today's I have selected a topic on acid peptic disease, which is very much more common in population. So what is acid peptic disease? As you know that excessive secretion of acid and pepsin or a weakened stomach mucosal defense is responsible for the damage to the delicate mucosa and the lining of the stomach, esophagus and duodenum, resulting in ulceration, which is known as acid peptic disease. Physiologically, a certain amount of acid is secreted by the gastric cells lining the stomach as a natural mechanism which serves to activate the digestive enzymes and helps in the digestion and assimilation of the important proteins so that they can be easily absorbed by the body. What are common types of ulcers? These are gastric and duodenal ulcers. Gastric and duodenal ulcers are the most common types of peptic ulcers, and acid peptic disease is a collective term used to include many conditions such as gastroesophageal reflux disease GERD, gastritis, gastric ulcer, duodenal ulcer, esophageal ulcer, Zollinger-Ellison syndrome ZES, and Meckel's diverticular ulcer. The commonest ulcers are the gastric and the duodenal ulcer, and mostly it is in the second part of the duodenum. Symptoms of peptic ulcer include abdominal pain, nausea, water brash, vomiting, loss of appetite and weight loss. Complications include bleeding, perforation, obstruction in the digestive tract, and sometimes cancer. Peptic ulcer is diagnosed using blood and stool test, breath test, and endoscopy and barium radiography. The patient is treated with drugs that reduce acidity and sometimes in addition with certain antibiotics to eliminate the H. pylori, Helicobacter pylori, causing the infection, which is a bacteria. Surgery may be required in some cases. What are the causes of acid peptic disease? So, acid peptic disease is a result of either a decreased gastric mucosal defense or an excessive acid production. Causes of acid peptic disease include: number one is Helicobacter pylori, which is responsible for around 60 to 90% of all gastric and duodenal ulcers. And then is the role of NSAIDs, non-steroid anti-inflammatory drugs, which are prostaglandins, protects the mucous lining of the stomach, and non-steroid anti-inflammatory drugs such as aspirin, diclofenac, sodium, naproxen, ibuprofen, brufen, indomethacin, Salindac. These prevent the production of these prostaglandins by blocking the cyclooxygenase enzyme, leading to ulceration and bleeding. And then is the third most cause: smoking, alcohol and tobacco use. Cigarettes, alcohol and tobacco cause an instant and intense acid production which acts as though gasoline is poured over a ringing fire. And then blood group O people are more reported to have higher risk for the development of stomach ulcers, as there is an increased formation of antibodies against the Helicobacter bacteria, which causes an inflammatory reaction and ulceration. So what are the causes of acid peptic disease? Helicobacter pylori is responsible for around 60 to 90% of all gastric and duodenal cancers. Then there is the role of heredity. Patients suffering from peptic ulcer disease usually have a family history of the disease, particularly in the development of duodenal ulcer, which may occur below the age of 20 years. Then there is the role of steroids or other medications like corticosteroids, anticoagulants like warfarin, comandrin, niacin, some chemotherapy drugs, and spironolactone can aggravate or cause ulcers. Then there is the role of diet also, which causes gastric ulcer. Low fiber diet, caffeinated drinks, and fatty foods are linked to the peptic ulcer, and spicy foods are also related to the duodenal and gastric ulcers. Other causes, other diseases, other comorbidities such as chronic liver, lung, and kidney disease, especially tumors of the acid producing cells, all predispose to peptic ulcers. Zollinger-Ellison syndrome (ZES) is a rare precancerous condition which causes peptic ulcer disease. It is a syndrome disorder wherein tumors in the pancreas and duodenum, also known as gastrinomas, produce a large amount of gastrin, which is a hormone that stimulates gastric acid secretion. Endocrine disorders such as hyperparathyroidism are also implicated in the development of peptic ulcers. And then is number one cause is stress and neurological problems which can be associated with the Cushing ulcer and the peptic ulcer. Sometimes people who are in stress or who are having some trauma, road traffic accidents, and those who have gone through surgery, and those who are bedridden, those who have immobility because of their some operative procedures being done on them, and also some patients of burns cases also may develop peptic ulcer disease. Symptoms and signs of peptic ulcer disease include abdominal pain, nausea, water breath, vomiting, loss of appetite, weight loss, and pain in the epigastric region and in the left side of the hypochondrium. So peptic ulcer disease is usually a chronic problem with a naturally history of relapse and remission, which can last for over 10 years or even more. And gastric and duodenal ulcers usually have common symptoms such as abdominal pain, a burning pain in the upper part of the abdomen, usually related to meal times, together with fullness, bloatiness, and distension of the abdomen with or without nausea, and generalized discomfort, also known as dyspepsia. The pain is usually so sharply localized that the patient can often indicate the exact place with 2 or 3 fingers, called the pointing sign. And gastric ulcer pain is more after the ingestion of meal, while duodenal ulcer pain occurs more due to hunger. Nausea, heartburns, vomiting, loss of appetite, and weight loss. Then gastric outlet obstruction. The ulcer could heal with scarring and result in narrowing of the gastrointestinal lumen. This could cause an obstruction to food being passed forward. Vomiting or passing stool, signs of bleeding as vomiting of the blood or black tarry color of the stools. And then bleeding and perforation from the ulcer. Bleeding from the site of the ulcer with thinning of the wall may result in the perforation of the intestine. Symptoms and signs of acid peptic disease are abdominal pain, nausea, loss of appetite, weight loss, etc. What is the difference between gastric ulcer and duodenal ulcer? Depending on the duration, peptic ulcers are classified into acute and chronic, and gastric ulcer develops more often in the elderly after the age of 60, while duodenal ulcers occurs around the age of 30 to 40 years. Gastric ulcers are more common in women, while men suffer more from duodenal ulcers. Chronic duodenal ulcers rarely develop into cancer, while chronic gastric cancers are potentially precancerous. Chronic gastric cancer is usually seen on the lesser curve of the stomach, while the usual area of the occurrence in a duodenal ulcer is the first part of the duodenum. And what is the differential diagnosis, complications, and diagnosis of acid peptic disease? So, the peptic ulcer is diagnosed during blood and stool test breath test, endoscopy, and rarely now barium radiography. Complications include bleeding, perforation, obstruction in the digestive tract, and sometimes cancer. And the differential diagnosis or other possibilities might include pain in the right upper part of the abdomen is usually seen in the following condition beside peptic ulcer disease, such as pancreatitis, such as cholecystitis, bile duct inflammation and biliary colic, gallstones, and hepatitis or hepatic congestion or stomach cancer, and pericarditis, inflammation of the covering of the heart, and pleurisy, inflammation of the covering of the lungs, and myocardial infarction or the heart attack. So, what are the complications beside having sleeplessness and insomnia due to pain and other dyspeptic symptoms, bleeding, perforation, penetration into other organs, and obstruction in intestines are other complications which can develop due to chronic or acute acid peptic disorders. Barrett's esophagus is a precancerous lesion which develops due to chronic GERD or gastroesophageal reflux disorder. GERD is a condition wherein the liquid content of the stomach regurgitates back into the esophagus, and this causes damage to the esophageal lining, resulting in esophagitis and Barrett's esophagus. And previously I have made a full discussion on the topic of gastroesophageal reflux disease, GERD, and you can see my video if you want to know more about GERD. So this causes damage to the esophageal lining, resulting in esophagitis and Barrett esophagus. An infection with H. pylori, Helicobacter pylori, responsible for peptic ulcer disease, can cause an atrophy of the stomach called atrophic gastritis, which is precancerous condition, and duodenal cancer is also a complication of the acid peptic disease. Then what is the diagnosis? Before instituting therapy, it is imperative to diagnose the ulcer disease and the H. pylori infection because treatment protocols are variable for different types of ulcer diseases. The treatment of an NSAIDs induced ulcer differs from the ulcer caused by H. pylori. So clinical history, medical and family history establish whether ulcers are present in the family. Other information such as the misuse of NSAIDs medicines such as ibuprofen and diclofenac sodium and brufen and flurbuprofen, Thalendac, meloxicam and indomethacins, which can be a causing factor and for peptic ulcer disease, and information regarding the use of alcohol, smoking and tobacco should also be elicited in the history. Also, the timing of food in relation to the pain and dyspepsia may help in the diagnosis. What are the blood tests? Blood tests such as the enzyme-linked immunosorbent assay ELISA help in the measurement of antibodies to H. pylori, and serum gastrin levels should be measured in patients with multiple ulcers to consider gastrin secreting tumors or Zollinger-Ellison syndrome. Tests for gastric secretion include the pentagastrin test, the chew and spit test, and the Hollander insulin test. Then we have stool test. Stool test detect the presence of H. pylori in the feces and also establishes whether there is any recurrence after antibiotic therapy, or we can do also antibodies of H. pylori in the stool. Then breath test, usually the urea breath test UBT is helpful in the detection of H. pylori. The patient is made to drink a liquid containing carbon labeled urea, which is broken down by the bacteria. The patient is subsequently asked to breathe into a sealed bag, which is tested for the presence of labeled carbon. A positive test indicates the presence of H. pylori infection. Then we have endoscopy. Endoscopy is considered a more accurate test for the diagnosis of peptic ulcer disease and also helps in taking biopsy of the affected area. Gastroscopy or the esophago-gastroduodenoscopy (EGD) is a kind of endoscopy which is carried out on patient to detect peptic ulcer. What is gastroscopy? Gastroscopy or esophago-gastroduodenoscopy (EGD) is a kind of endoscopy which is carried out on patient to detect peptic ulcer. Then we have barium radiography or barium studies. X-rays are taken of the stomach, esophagus and duodenum after swallowing barium, and the retention of contrast dyes in the ulcer is monitored, and filling defects are also can be detected. Treatment for acid peptic disease is by the medications that will reduce acidity and sometimes in addition with certain antibiotics to eliminate the H. pylori causing the infection. And surgery may be needed in cases of complications. What is medical treatment? Medical treatment include the diet. Dietary therapy relate to avoidance of spicy and oily foods which increases acid production and are difficult to digest. Avoid tea and coffee, alcohol, aspirin and other NSAIDs, medications, chocolates, tobacco and cigarettes, including e-cigarettes as well. Meal should preferably be light and at small intervals. Take snaps in the taking some gaps in the dietary pattern. So eradication of H. pylori is another way. There are three ways to approach to eradicate the H. pylori, which involve diagnosis, treatment and confirmation of the cure of H. pylori infection. The standard protocol to eradicate H. pylori involves the use of 2 or 3 antibiotic, example amoxicillin, tetracycline, clarithromycin or metronidazole, and the use of a proton pump inhibitor, example esomeprazole and the omeprazole and lansoprazole, rabeprazole, pantoprazole with or without a bismuth compound for around 2 to 3 weeks and repeated if there is recurrence. So avoid NSAIDs such as ibuprofen, brufen, indomethacin and NSAIDs, flurbuprofen, indomethacin, salindac, diclofenac sodium or the piroxicam, meloxicam type of medications, or the concurrent use of prostaglandin analogs such as misoprostol may be prescribed to prevent peptic ulcer due to NSAIDs. So the use of antacids or H2 receptor antagonist R2RAs such as cimetidine, ranitidine, famotidine and nizatidine, which help in the reduction of gastric acid secretion and in turn increase the gastric pH and reduce the secretion of pepsin. But recent studies have shown that ranitidine is involved in causing the gastric and duodenal cancers. The treatment of peptic ulcer complication includes a blood transfusion for hematemesis and melena, the use of antacids and H2 receptor antagonists, which are the safest one for pain. But nowadays it is established that ranitidine or Zantac is no more used because of it was causing cancer in the population who were given H2 receptor blockers. So it is being avoided and not being given to the patients at the moment. The use of other medications such as proton pump inhibitors might be helpful, and The treatment of peritonitis in case of perforation of peptic ulcer disease is also having a role in the treatment of peptic ulcer complications. So maintenance with the proton pump inhibitors is usually effective and relatively safe. And avoid tea, coffee, alcohol, tobacco, cigarettes, aspirin and other NSAIDs to prevent the ulcers. Then there is the role of surgery. Surgical treatment of ulcer may be indicated for patients with failure to respond to medical line of treatment or both with the complications such as increased pain, bleeding, obstruction and perforation. What are the options which can be taken in as a surgical point of view for reduction of acid peptic disease? Now there is the role of elective surgery for peptic ulcer disease, which has diminished significantly over the past 15 years. However, emergency surgery has not shown a decline. Some series have reported an increase in hospitalizations and operations for hemorrhage. The appropriate surgical procedure for peptic ulcer disease must be tailored to the specific needs of the individual patients. During emergency operations for hemorrhage from the duodenal ulcer, we recommend suture ligature of the bleeding vessel and vagotomy pyloroplasty for high risk patients, or vagotomy and tracheotomy for the lower risk patients. Bleeding gastric ulcers should be resected if possible. For massive hemorrhage from stress ulceration requiring surgery near total or total gastrectomy should be performed. Perforated duodenal ulcers are best managed by closure and definitive ulcer operations such as vagotomy pyloroplasty. Perforated gastric ulcers are best excised but may be simply closed if conditions do not favor resection. In this situation, biopsy should be performed and we recommend truncal vagotomy and tracheotomy for patients presenting with obstruction. Vagotomy, truncal or proximal gastric with drainage, is an acceptable alternative in this situation for patients with intractable ulcer disease or for those who are non-compliant. Proximal gastric vagotomy is the preferred operation. However, other operations may need be considered depending on the specific situation, and recurrent ulceration need appropriate workup to determine the possible cause. Although patients with ulcer recurrence initially may be placed on medical treatment, about 50% will require reoperation. The most effective procedure for peptic ulcer disease is truncal vagotomy and tracheotomy, which has a recurrence rate of less than 1%. The procedure with the least morbidity and the fewest undesirable side effect is proximal gastric vagotomy. Ulcer recurrence after proximal gastric vagotomy or truncal vagotomy pyloroplasty is in the range of 10% to 15%. There are many operative methods that could be used to treat perforated peptic ulcer. Primary closure by interrupted sutures covered with a pedicled omentum on top of the repair, Celan-Jones repair, and plugging the perforation with a free omental plug, Graham patch, are the most common techniques. Then, what is the best treatment for an acid peptic disease? Proton pump inhibitor, also called PPIs, reduce stomach acid by blocking the action of the parts of the cells that produce acid. Then these drugs include these prescription and over-the-counter medication: omeprazole, Prilosec, and lansoprazole, Prevacid, and rabeprazole, Achifix, and esomeprazole, Nexium, and pantoprazole, Protonix. What is the most common treatment for peptic ulcer? Proton pump inhibitors are usually prescribed for 4 to 8 weeks, and omeprazole, pantoprazole, lansoprazole are the PPIs most commonly used to treat stomach ulcers. And the first line of treatment of therapy is the PPI inhibitor, drugs that block the three major pathways for acid production, and PPIs suppress acid production much more effectively than H2 blockers, and PPIs are the gold standard in medication therapy of peptic ulcer disease. Peptic ulcers usually heal with the medication and lifestyle changes. For people who do not respond to medication or have experienced complications such as hemorrhage, perforation or obstruction, then surgery is the best option for them. Current surgical operation for the management of peptic ulcers and their complications include truncal vagotomy and pyloroplasty, truncal vagotomy and tracheotomy, parietal cell vagotomy, PCV, subtotal gastrectomy, patch repair for ulcer perforation, and overswing of the bleeding vessels are the procedures being done nowadays. Gastric perforation can be managed via an omental patch or a wedge resection in the setting of ulcer disease or with primary repair in the setting of trauma. In the post-operative period, the patient must be continued on PPI to prevent recurrence, and untreated or delayed cases can carry a very high mortality. Digestive function disorder and peptic ulcer disease characterized by dyspepsia, discomfort, heartburn, or nausea. However, the classic symptoms of peptic ulcer disease defined as the pain centered in the upper abdomen or discomfort characterized by fullness, bloating, distension, or nausea. What is the procedure for the stomach ulcer? Endoscopy is necessary for the accurate diagnosis and treatment of gastric ulcers. Gastroscopy or endoscopy is the most common procedure for diagnosing peptic ulcer disease. It allows doctors to take pictures of the digestive tract. Famotidine injection was used in people who are hospitalized to treat certain conditions in which the stomach produces too much acid or to treat the ulcer sores. So it was the information in 2016, but nowadays these medications are forbidden and are not used further. What kind of surgery you will require for the ulcers? If you have a serious ulcer that keeps returning and does not get better with medication, your doctor may suggest surgery. You will need emergency surgery if you have a bleeding ulcer called hemorrhagic ulcers. So, surgical intervention may include resection of the perforated viscus with the reanastomosis or the creation of a fistula, elimination of the source of infection and reduction of bacterial contamination of the peritoneal cavity, and prevention or persistent or recurrent infections. Pantoprazole injection is used to treat certain conditions in which there is too much acid in the stomach. It is used for short-term treatment, 7 to 10 days of gastroesophageal reflux disease with a history of erosive esophagitis. While drinking milk help ulcer, no milk may temporarily soothe the ulcer pain, but it coats the stomach lining. But milk also causes your stomach to produce more acid and digestive juices, which can make the ulcers worse. So, what is laparotomy surgery? Laparotomy, also known as ciliotomy, is performed by making a large incision in the abdomen to gain access to the peritoneal cavity. And standard laparotomy usually involves a sagittal midline incision along the linea alba. So, which capsule is best for acidity and gas? Digoxin tablet is an instant solution to acidity and gas issues like bloated stomach and excessive belching. And this effective chewable tablet works by neutralizing the excess stomach acids that cause symptoms of acid reflux, and simethicone in the dosage of 50 mg thrice a day might be helpful in bloatiness and abdominal distension and gases formation. What is the best syrup? Gaviscon syrup is one of the best gas relieving syrups, and it contains compound like alginate that acts as an antacid and antiflatulent that helps in relieving gases. Alginates work by forming a protective barrier in the stomach that blocks the stomach acid from coming up to the esophagus and the throat or causing the GERD. Some of the effects of Gaviscon might include hypotension, nausea, vomiting, EKG changes, respiratory depression, loss of deep tendon reflexes, and dilated pupils, altered mental status, and coma. And too much of Gaviscon may cause side effects as wind and bloating when your stomach feels tight and full of gases. So, it is safe to take Gaviscon for a long time. Gaviscon does not usually cause problems when you take it for a long time. Tell your doctor if you need to take it regularly for more than a week. And taking too much Gaviscon may cause side effects such as wind and bloating Your stomach feels tight and full of gases. Taking large doses of calcium carbonate every day for prolonged periods can lead to high levels of calcium in the blood. Children and adults 12 years and over 2 to 4 tablets after meal and at bedtime up to 4 per day. Children under 12 years should be given only on medical advice. So you can give the Gaviscon to relieve the symptoms. And what are the symptoms of acid production? Difficulty in swallowing or sensation of food being stuck in your throat, frequent burping or hiccups for no apparent reasons, burning sensation and pain in the chest, regurgitation, prolonged sore taste in mouth or bitter tasting acid backs up into your throat are the symptoms involving that you are producing more acid in your stomach. With drugs such as pseudoephedrine and Clarinex and Deconsal, Clarithin D and levodopa should not be taken with antacids. And you can take omeprazole with an antacid, for example Gaviscon. It takes 2 hours before or after your dose of omeprazole. And the significant interaction with antacid do occur with certain number of quinolones, medicines and non-steroid anti-inflammatory drugs, NSAIDs and cephalosporins. Is acidity a serious problem? However, when acid reflux occurs frequently and is untreated, it can lead to conditions such as esophagitis, ulcers, strictures, aspiration pneumonia and Barrett esophagus. People who have frequent episodes of acid reflux are also at slightly increased risk for developing esophageal cancer. So, which food contain acid? Whole grains such as oatmeal and brown rice contain the antacids, and root vegetables such as sweet potatoes, carrots and beets. Green vegetables such as asparagus, broccoli and green beans contain the antacids properties. So is yogurt an antacid? Yogurt that is not too sour is also excellent for acid reflux because of the probiotics that help normalize bowel functions. Yogurt also provides proteins and soothes stomach discomfort, often providing a cooling sensation. Rice fiber content and healthy complex carbs in rice are great to reduce heartburns. What about the apple juice? Acid reflux occurs when stomach acid rises into the esophagus. Some say that eating an apple after a meal or before bedtime may help neutralize this acid by creating an alkaline environment in the stomach. Sweet apples are thought to work better than sour varieties. And is chicken acidic? Acidic foods includes red meat, chicken, fish, chocolate, wheat and alcohol. And neutral foods include neutral fats like butter, most oils and milk and cream. So is banana good for acidity? Bananas, this low acid fruit can help neutralize stomach acid by coating an irritated esophageal lining. And not only are bananas alkaline, they also rich in pectin, a soluble fiber that helps food flowing nicely through the digestive tract. Is pomegranate good for acidity? Pomegranate juice is a refreshing beverage that is rich in vitamin C. However, it can trigger reflux and heartburn due to its high acidity content and low fiber content. And is tea acidic? Most teas are mildly acidic, but some teas shows the certain teas may be as low as 3. If you are a tea lover, you may wonder if this means your cup of tea is hurting your teeth. Fortunately, it's most untrue. Home brewed teas are not as acidic fruit juices and other drinks. The pH of the fresh egg yolk is about 6 and increases to 6.4 to 6.9 during storage. Storage at refrigerated temperature greatly slows the pH change and help reduce the rate of thick egg white from thinning In general, the egg pH is stable and does not disrupt the food product formulas. Onions are acidic. Raw onions are especially acidic, so cooking onions completely before consumption may ease your heartburn symptoms. What is about the Coca-Cola drink? How acidic is Coke? Its pH is reported to be 2.6 to 2.7, mainly due to the H3PO4 phosphoric acid. As a fizzy drink, it contains plenty of dissolved carbon dioxide, but this makes very little contribution to the acidity. But it should not be taken by the people who are having the acid peptic disease. As far as honey is concerned, the acid contained in honey make it relatively acidic. So honey contains a number of acids which include amino acids 0.05% to 0.1% and organic acid 0.57% range is about 0.17 to 1.17%. The average pH of the honey is 3.9 with a typical range of 3.4 to 6.1. What about the milk? Fresh milk is slightly acidic, but it is not a strong acid. Depending on freshness and source, the acidity differs. The lactobacillus bacteria makes lactic acid in milk and increases the acidity over time. However, lactic acid being a weak acid itself cannot make milk show strong acidic properties. The cocoa powder in chocolate is acidic and may cause your symptoms to increase. So, cocoa can cause the intestinal cells that relax the esophageal sphincter to release a surge of serotonin, and when this muscle relaxes, gastric contents can rise. So, is ice cream good for acidity? Furthermore, cold dairy product like ice cream can actually numb and inhibit the lower esophageal sphincter function. Eat a small serving with each meal. Dairy foods, limit whole milk, cream, ice cream, and full yogurt. Dairy product can increase stomach acid and high fat content. So, is green tea acidic? Yeah, likely the majority of teas vary, and green tea is also acidic in nature, and excess consumption of tea will lead to acid reflux. Don't consume green tea on an empty stomach. Have something at least 1 hour or so to prevent gastritis. So this was all about acid peptic disease that I have covered in my topic, and I hope so that you would have liked this video, and kindly don't forget to subscribe my channel, and if you have liked this video, then kindly share this video with other individuals who are suffering from acid peptic disease or who are more prone to develop acid peptic disease because of their dietary patterns and their lifestyle changes. In the last, I will end my discussion with the Napoleon's two quotes. Number one, the people to fear are not those who disagree with you, but those who disagree with you are too cowardly to let you know. And the second one quote is, a throne is only a bench covered with velvet. Put your iron hand in a velvet glove. So these were famous quotes of Napoleon's. Thank you for listening my video and watching my video, and have a wonderful nice day. Thank you very much.